Why is swollen joint count, SJC, vital for tracking raw progression? Imagine trying to understand how rheumatoid arthritis is affecting someone's joints without actually looking at them. That's where the swollen joint count comes in. It's a simple yet powerful tool that helps doctors see how active the disease really is. When joints are swollen, it means the lining inside the joint, called the synovium, is inflamed. This inflammation causes pain, stiffness, and over time, can damage the joint structure itself. The swollen joint count measures exactly how many joints are visibly swollen, giving a clear picture of ongoing inflammation. Why is this so important? First, because swollen joints directly show the level of inflammation happening inside the joint. Unlike tender joint counts, which can be influenced by pain perception or other factors, swollen joint counts are more specific. They tell us whether the disease is actively attacking the joints or if it's under control. This makes SJC a reliable marker for disease activity. Second, research shows that the number of swollen joints over time can predict how much joint damage will occur in the future. If a person has many swollen joints that persist over months or years, the risk of joint erosion and cartilage loss increases. This damage can be seen on X-rays and is a sign of disease progression. So, tracking the swollen joint count helps doctors anticipate and prevent long-term joint destruction. Third, because rheumatoid arthritis can fluctuate, a single swollen joint count might not tell the full story. Monitoring how many joints are swollen over time, especially in response to treatment, gives a more accurate picture of how the disease is progressing. If the count decreases, it often means the treatment is working. If it stays high or increases, it signals that adjustments might be needed. Fourth, SJC is useful for seeing how well treatments are working. When a patient starts a new medication or therapy, a reduction in swollen joints usually indicates that inflammation is being controlled. Conversely, if swollen joints remain or increase, it suggests the disease is still active or flaring. Patients can even track their own joint swelling at home, helping to inform their healthcare team and decide when to seek medical advice. Finally, the swollen joint count is part of important tools used to assess disease activity, like the Disease Activity Score 28. These scores combine the swollen joint count with other measures such as tender joints, blood tests for inflammation, and patient feedback. They help doctors make informed decisions about treatment plans and whether a patient is in remission or needs more aggressive therapy. In summary, the swollen joint count is a key piece of the puzzle in managing rheumatoid arthritis. It provides an objective, measurable way to track inflammation, predict joint damage, and evaluate how well treatments are working. Regularly monitoring SJC helps catch worsening disease early, guiding timely treatment adjustments, and supporting better long-term outcomes. Always remember, individual experiences vary, so it's essential to work closely with healthcare professionals to interpret these measures and develop a personalized management plan.